Hi all. This is the Best Facts channel, and in this video we will tell you about the most interesting facts about coronavirus that many people don't know. Scientists are still gathering information about the new coronavirus infection. But a considerable amount of knowledge has already been accumulated. Almost 2 years ago, on December 1, 2019, the first case of infection with a new coronavirus, later named Covid-19, was reported in China. The virus is changing, as is the information about it. Scientists are now focusing on the following facts. Number 1. COVID-positive patients are not infectious 10 to 11 days after symptoms appear. Leo Sin, executive director of Singapore's National Center for Infectious Diseases, said a person with the coronavirus ceases to be infectious 11 days after symptoms appear. The U.S. Centers for Disease Control and Prevention (CDC) released an update on the issue of contagiousness on October 19. Virus replication is significantly reduced by the 10th day from the onset of symptoms. Patients with mild to moderate severity have no viral replication, multiplication, after the 10th day. It may be observed in some patients with a severe form for up to 20 days. Number 2. Wearing masks helps curb the rate at which the disease increases. Mask wearing in public places is mandatory in 127 countries. According to experts at Johns Hopkins University, wearing a mask in public places deters the spread of coronavirus infection, particularly its transmission from people who have COVID-19 asymptomatically, and may not be aware of their COVID status. The mask helps retain the nasal and throat mucosal secretions by which SARS-CoV-2 is transmitted from person to person. Controlling the rate of illness is critical to preventing the collapse of healthcare systems. Number 3. Mortality from the new coronavirus is higher than from the flu. Scientists conclude that lethality from the virus is higher than from seasonal influenza. Between 0.3% and 1.5% of all cases of COVID-19 infection end in death. WHO estimates that 290,000 to 650,000 people die each year from seasonal influenza and related complications. Number 4. Reinfection with coronavirus is possible. According to Rospotrobnadzor head Anna Popova, 10 cases of reinfection by COVID-19 have been officially registered in the world. The first case has been registered in Hong Kong. A 33-year-old man has received a positive COVID test 4.5 months after his first infection. Researchers at the University of Hong Kong reported that they studied both patient samples, first and repeat, and found significant differences. The man became infected a second time after traveling to Spain, where the scientists suggested he had encountered a new strain that was circulating in Europe. Number 5. Antibody titers in COVID-19 survivors decrease in the first few months after recovery. Several studies indicate that antibodies developed during the disease and the body's immune response noticeably decrease or disappear in the months or even weeks after recovery. Patients who have had the new coronavirus asymptomatically lose antibodies faster than those who were more severely ill. According to Oleg Totolian, director of the St. Petersburg Pasteur Research Institute of Epidemiology and Microbiology, about 15 to 20% of those who have had the disease will lose antibodies. This raises doubts as to whether COVID-19 leaves behind reliable immune protection. The hypothesis continues to be studied worldwide. Number 6. Mass vaccination against coronavirus will not begin until mid-2021. These are the predictions of WHO spokeswoman Margaret Harris. As of October 19, 2020, there are 44 vaccines in clinical trials from manufacturers around the world, according to WHO data. 10 vaccines are in the final third phase of clinical trials, including Russia's Sputnik V. None of the drugs have passed the full cycle of clinical trials. Their safety and efficacy has not yet been proven. Vaccination against coronavirus is currently only possible in clinical trials as a volunteer. Number 7. To acquire population immunity, 60% of the world's population must be infected. This is the collective opinion of the scientific community. The acquisition of population immunity is seen as one scenario for the end of a pandemic. The idea is that when a sufficiently large number of people are already immune, the infection has no distribution channels and outbreaks quickly fade away. For example, collective immunity against measles requires 95% of the population to develop antibodies, and against polio, 80%. However, the head of WHO Tedros Ghebreyesus stated that it is unethical to wait until the majority of the population is sick with COVID-19 and collective immunity must be achieved through vaccination. Number 8. Children can transmit the coronavirus. Researchers at Johns Hopkins University say that infected children have as much COVID-19 viral genetic material in their upper respiratory tracts as infected adults. The high amount of viral RNA in children does not prove that they are infectious. However, the presence of a high viral load in infected children increases the fear that they can easily transmit the infection to others even without symptoms. At the same time, according to Alexey Agranovsky, professor at the Department of Virology, Faculty of Biology, Moscow State University, children carry the disease more easily than adults. Number 9. Doing a CT scan without symptoms of coronavirus is not advisable. According to Professor Igor Tyurin, chief specialist in radiation and instrumental diagnostics of the Ministry of Health of Russia, CT scan of the chest does not solve the problem of COVID-19 diagnosis. Only a PCR test can tell about the presence or absence of infection. Doing a CT scan for prevention without symptoms of respiratory infection, fever and shortness of breath, and serious risk factors, severe diabetes, severe heart failure, severe overweight, makes no sense. Increasing the collective dose could potentially cause radiation-induced disease. Number 10. Mask glove regimens are not effective in controlling coronavirus. According to recommendations from the U.S. Centers for Disease Control and Prevention, CDC, wearing gloves is only appropriate if you are caring for someone who has COVID-19 at the moment or disinfecting the room after a sick person. For everyone else, regular hand washing with soap and water, or the use of antiseptics containing at least 60% alcohol is sufficient. The position of Russian authorities on gloves is ambiguous. Vladimir Chulinov, chief freelance infectious disease doctor of the Russian Ministry of Health, changed his mind about the need to wear gloves in one day. Number 11. Social distance works, but 1.5 to 2 m is not enough. Social distance continues to be the basic measure for preventing COVID-19 infection, according to the WHO. However, researchers at Oxford University have called the 2-meter distance recommendation outdated. Small COVID-19 particles can travel up to 7 to 8 m when an infected person coughs or screams. The choice of distance is influenced by a host of factors: type of action, indoor and outdoor conditions, ventilation levels, weather, and the presence of face masks. Number 12. There are 4 groups of people who have poor antibody production. 4 groups of patients with poor antibody production are named. These include the elderly, those who abuse alcohol, people who are constantly stressed, those who take statins, cholesterol-lowering drugs, and anti-inflammatory drugs that affect cell proliferation, usually cancer patients. Number 13. 22 coronavirus mutations have been reported. According to Rospotrobnadzor press service, several thousand mutations of coronavirus have been discovered since the beginning of the pandemic. Of these, 22 have been recorded and are steadily inherited. These mutations occurred between January and March. WHO notes that the virus is changing but not becoming more aggressive. Number 14. COVID-19 risk factors for death have been named. Scientists in Great Britain published a study in which they named kidney disease as a factor that more than doubles the risk of death when infected with coronavirus infection. The second aggravating factor, Yevgeny Shliakto, member of the Russian Academy of Sciences and general director of the VA Almazov National Medical Research Center, calls obesity. According to him, in patients with obesity the risk of severe coronavirus infection increases 7-fold, and the risk of death 9-fold. In addition, Shliakto also calls vitamin D deficiency an unfavorable factor. No. 15. The coronavirus pandemic does not prevent seasonal flu vaccination. According to the University of Liverpool, consecutive influenza and coronavirus significantly increase the risk of death. Therefore, in the absence of a proven effective and safe COVID-19 vaccine, the importance of seasonal flu vaccination increases. Infectiologist, MD Nikolai Malashev speaks about the need to get vaccinated against influenza, to avoid a severe combination of diseases. Number 16. The first blood group is the most resistant to the coronavirus. According to a study by Aarhus University and the University of Southern Denmark, people with the first blood group are less likely to be infected with the new coronavirus. The risk of contracting COVID-19 in the owners of the first blood group is 13% lower than in other people. At the same time, Harvard Medical School officials state that blood type is not related to the severity of symptoms in people who test positive for COVID-19. No. 17. Dexamethasone is the only drug proven to be effective against COVID-19. Tedros Ghebreyesus, head of the WHO, named the corticosteroid dexamethasone as the only effective therapeutic agent against COVID-19 in patients with a severe course of the disease. In interim results from a study of dexamethasone for the treatment of coronavirus, Ghebreyesus noted that administration of dexamethasone reduced mortality by 1/3 among patients on ventilators and by 1/5 among patients requiring oxygen therapy. Number 18. Remdesivir, hydroxychloroquine, ritonavir, and interferon alpha drugs are not effective in treating coronavirus. An international clinical trial initiated by WHO to find an effective treatment for COVID-19 found that the drugs hoped for remdesivir, hydroxychloroquine, ritonavir and interferon alpha preparations do not reduce mortality from coronavirus. For example, the data on the drug remdesivir, which was registered in Russia in October, among patients who took remdesivir there were 301 deaths in 2,743 patients, and among patients who did not take remdesivir there were 303 deaths in 2,708 patients. Drugs with the active substance favipiravir, released in Russia in free circulation, according to international studies, are also not effective in the fight against coronavirus and also have severe side effects. Number 19. All those who have had COVID-19 will need rehabilitation. All patients need rehabilitation, regardless of the presence or severity of their impairment. But it will be especially necessary for patients who have had moderate to severe infections. First and foremost, lung function is impaired, and more specifically, their ability to take in oxygen from the air and pass it on to all organs. Number 20. Prolonged COVID can last several months. Experts from the National Institute of Health in the United Kingdom told us that even after recovery, people can still experience the effects of the virus for a very long time. This phenomenon has been called lingering COVID. Fatigue, difficulty concentrating, hair loss, and a prolonged inability to sense tastes and smells can become long-term companions of those who have had COVID-19. The authors of a study from King's College London, using the COVID Symptom Study app, in which COVID-positive patients regularly record their symptoms and well-being, found that older people, women, and those who had the most pronounced symptoms in the first week of illness were more likely to suffer from lingering COVID.